Hi, welcome to Unacademy. This channel is Unacademy Future Doctors, and I am Dr. Shivangi Shukla, your educator for biochemistry, here on this channel as well as on the Unacademy app. Let me just check if the live stream has started or not, and then we can continue our class. All right. Just give me a second to check if the live stream is on. Do let me know if I'm visible and audible to everyone. Just give me a second to check if the live stream has started. So this is the MCQ based session. We have already completed quite a few MCQ based sessions, and now is the time for another one. Just give me a second to check if the live stream has started. You can also let me know in the comment section. Sometimes it takes some time to show up here. Okay, so until and unless the session has started, it wouldn't be good to start off, right? So anyway, I'll just brief you about the different types of subscriptions for NEET PG that are available on the Unacademy app. Alright, so you have the iconic as well as the plus subscriptions, as all of you would be knowing about. Let us wait for the others to join in, and then we can continue. The plus and the iconic subscription both will give you access to lectures from medical educators across the country. Okay, and give you access. Yeah, all right. So I can see that the live stream is on. All right. So now both the plus as well as the iconic subscription will give you access to video lectures from top educators across this country in the field of medicine. Now these lectures can be accessed live like this one or recorded. Okay, both on the Unacademy app. So you have the ease of accessing them on any device of your choice at any time, whatever pleases you. This is the USP of this online education here on Unacademy, because you get to have access to recorded lectures as well. Also, there will be not just lectures but PDF notes of the educators, and question banks containing more than 25,000 questions, which are regularly updated and which are exhaustive in the sense that they cover the entire syllabus of biochemistry and any other topic any other subject that is there in medicine, all the 19 subjects. Okay. The iconic subscription will in addition provide you resources from Prep Ladder as well. So it's called Best from Two of the Best. Okay. Now, Unacademy has also come up with a rapid revision course for spanning 2 months from March 16th to May 16th. This is specially dedicated to those who are going to take the NEET PG examination this year in 2022. Okay, here you have revision classes, revision lectures from more than 40 educators and 19 subject-wise tests and 8 grand tests. Okay, so it is a good way to gauge your preparation and also a last-minute revision in a disciplined manner. Okay, now whichever subscription you wish to take, do not forget this code DRSHUKLA Dr. Shukla, which will fetch you a 10% additional discount on plus as well as the iconic subscriptions, either of the subscriptions which you wish to take. The code is DRSHUKLA Dr. Shukla. Okay, so we have completed quite a few questions. I think till 21 questions we have completed. This one also, this also, and this also we did. I think this one also we did. This, yeah. So let us start from this question today. Okay. The L and D forms of glucose are determined by its relation to. Now, let me tell you about the rules. You have to answer in the comment section. For each question, I will be providing you with approximately 2 minutes time, 2 minutes time duration to answer. During those 2 minutes, you can rack your brains and come up with the answer, and let me know in the comment section. Okay, no points for getting it right. No points for answering early, but I'll be very happy if you take the whole 2 minutes but answer correctly. Only points are there for correct answers. Okay. So the L and D forms of glucose are determined by its relation to A. Fructose, B. Glyceraldehyde, C. Mannose, or D. Glycerol. Okay, now even if you don't know the answer, I would advise you to at least attempt using the common sense that you have. A little bit of elimination strategy can work here. So you can treat it as an MCQ question that you would get during examination, and then see how you apply the strategy of elimination. It can be a practice. Okay. So the L and D forms of glucose are determined by its relation to which of the following biomolecules, which of the following compounds: A. Fructose, B. Glyceraldehyde, C. Mannose, or D. Glycerol. Alright, your time has started. Come on, do let me know in the comments section. Come on, the live stream is already started. Come on, I should see answers here. It is not a very difficult question. So I hope you guys answered, applying your common sense. Come on, time is running up. Make sure you answer to each and every question. Okay, because it is important so that you know how to attempt questions. Last few seconds left, last 30 seconds left. Come on. Capital L and capital D. A clue, a hint. There's something called small l, small d. There's something called capital L, capital D. Are these all the same? Come on, think about it and then answer. Okay, so the time for answering is over now. Now I'll tell you the answer. The L and the D forms of glucose are determined by its relation to glyceraldehyde. Now what is glyceraldehyde? It is a 3-carbon sugar. It's 3-carbon aldehyde. And what is glucose? Glucose is a 6-carbon aldehyde. Okay, now first of all, glycerol has no similarity to glucose because glycerol is an alcohol and glycerol is present in esterified form with fatty acids to form lipids. Okay, so this one is totally the odd one out. Fructose is a ketone, it contains a ketone functional group. So fructose is also out of the question. Now between mannose and glyceraldehyde, if you would have if you have attended these MCQ sessions sincerely, then you would know that mannose and glucose are not isomers, rather they are epimers at the second carbon position. Now what are epimers? Epimers are those compounds which differ from each other in the position of side groups about 1 carbon position. Okay, just 1 carbon. So mannose and glucose are epimers at the second carbon. Glucose and galactose are epimers at the 4th carbon. Xylulose and ribulose are epimers at the 3rd carbon. Now for epimers, what happens is their structure is between mannose and glucose, there will be some difference. Okay. But here it is asking, how do you name the L and the D forms of glucose? So you name them based on some blueprint, on some some skeletal framework, and that skeletal framework is the 3-carbon aldehyde of glyceraldehyde. Now you make a 3-carbon aldehyde chain. This is the CHO group of aldehyde, and this is the alpha carbon just near the functional group. Now, depending upon the position of H and OH, it can either be L or D. Okay. Now, if you extend this chain to include 3 more carbons, then it will become what? It will become glucose. So, just by extending glyceraldehyde, if you extend L-glyceraldehyde to 3 more carbons, it will become L-glucose. If you extend D-glyceraldehyde by 3 more carbons, then it will become D-glucose. So the skeletal framework for determining L and D forms of glucose is provided by glyceraldehyde. Now you should also remember that the L and D forms of amino acids are also dependent on the skeletal framework of glyceraldehyde. Okay, understood this? Now the L and the D forms are geometrical isomers, whereas the small l and the small d forms are optical isomers that rotate the plane polarized light to either left or dextro, that is right. Okay, now L can be either L or D. Similarly, D can be either L or D. There is no correlation between. Understood this? It is very, very important. Now, for amino acids, one more trivia you should know of is that all the amino acids that are incorporated into proteins in the body are of the form L. L-alpha amino acids. Only L-alpha amino acids are present in proteins. Whereas the free amino acids in the body, free amino acids can be either L or D. So if someone tells you only L-alpha amino acids exist in nature, then that is absolutely false. Okay? Only L-alpha amino acids exist incorporated into proteins. Absolutely true. Okay? Whereas the free forms of amino acids can either be L or D. Okay? Should we move on to the next question? Is this one totally clear? The next one, the reducing agent used in lipogenesis is derived from lipogenesis. Now, what is this? What is this process called? What is this lipogenesis. What is the meaning of lipogenesis? This also you should know. Okay, what is this procedure? So A is A, gluconeogenesis, B, glycolysis, C, beta oxidation, or D, HMP shunt. Okay, your time starts now. Come on, answer this. I think this one is a given. This one is a very obvious answer. So please think before you answer. I want all of you to answer it correctly. Lipogenesis. What is lipogenesis? This, even if you get this answer correct, I want you guys to know, to understand the definition of lipogenesis. There are 4 steps. There are 4 reactions. There are 4 there are 4 processes about which you should know. The definition of which you should know. Very important. The keywords in the definition of these 4 processes. Okay. Come on, time is running up. Okay. So the correct answer here is what? It is the HMP shunt. And what is the purpose of the HMP shunt? What does the HMP shunt do? The HMP shunt does not produce ATP. It is an alternative metabolic cycle for glucose. That is why it is called shunt. Glucose is shunted here from glycolysis. So glycolysis is used to produce what? Glycolysis is used to produce ATP, whereas the HMP shunt is used to produce It is used to produce two important intermediates. What are these intermediates? NADPH. NADPH are reducing equivalents and ribose sugar. Ribose sugar can be used to produce RNA, or in the deoxy form can be used to produce DNA, that is nucleic acids. Okay, next question. Which of the following are mediators of post-translational assembly of proteins? A. Ubiquitin, B. Primers, C. Chaperones, or D. Domains? Okay, your time has started. Come on, try and answer this. Mediators of post-translational assembly of proteins. Hey, hi Jatin. Jatin has answered with a A. Okay, mediators of post-translational assembly of proteins. Are you sure, Jatin? Jatin has just now taken his first prof examination, isn't it? You want classes for micro? Are you sure? First of all, just look at the question first and then answer. Mediators of post-translational assembly of proteins, Jatin. Assembly is the key word here. The correct answer here is what? It is. Hey, no, Jatin, you were a very hardworking student. Every day you used to revise, you used to study, and then you used to attend these sessions also. It is all because of your hard work. Okay. Now, the correct answer here is what? It is chaperone proteins. I think you got confused between protein degradation and protein assembly. Protein degradation is mediated by ubiquitin. So, any protein in the body that has to be degraded, that has to be destroyed after it has served its purpose. So, what is happening? All the biomolecules that are produced inside the body have to be degraded and excreted also, because they cannot be kept on forever. Okay. So, degradation of proteins after they have aged occurs after ubiquitinization. Ubiquitin, as the name suggests, ubiquitous means something that is present everywhere. So, this ubiquitin protein is present in every cell and it mediates degradation of proteins. Okay. Now, defective ubiquitinization leads to a lot of diseases. Two important diseases that you should know of are von Hippel-Lindau disease, that affects a lot of systems like the renal system, the eyes, retina, and the other important disease is Angelman syndrome. It is also known as happy puppet syndrome. The child here has ADHD, a lot of repetitive actions. The child is always smiling, clapping. Okay, happy puppet syndrome. Chaperone proteins are used in post-translational assembly of proteins into tertiary and quaternary structure, that is functional structure. Okay. Okay, so Jatin, you wanted to repeat it? See, what is the difference? See, primer you already know. Primers are those molecules, those substances that can start a reaction. Like for DNA synthesis, you have RNA primer. You have primers, okay? RNA primers that start DNA replication. For glycogen synthesis, also you have glycogenin primer. Now, what are domains? Are what? Domains are functional groups present in tertiary structure. Okay, the functional groups of proteins present in comprising the tertiary structure. Chaperone proteins are those proteins that help in the folding of proteins into tertiary and quaternary structure, into the functional state. Chaperone means nurse, means nanny. Okay, ubiquitin proteins are present in every cell and they help in degradation of proteins. Any protein that has to be destroyed, degraded, is first conjugated with this ubiquitin protein and then it is subject to hydrolysis, degradation by lysosomes and all. Understood? Next question. Which of the following is suggestive of diabetic ketoacidosis? A. High serum insulin, increased serum fatty acids, high blood sugar. B. High blood sugar, increased insulin to glucagon ratio, increased CAMP. C. High blood sugar, increased glucagon to insulin ratio, increased blood pH. D. High blood sugar, increased glucagon to insulin ratio and decreased blood pH. Okay. Now do let me know which of these is correct. Okay, your time has started. Okay, so the time for answering is almost over. Okay, Jatin, we'll see what we can do about it. Okay, I'll let you know about any such classes. All right, now, so Jatin is answering with a C. All right, diabetic ketoacidosis. Look at all the three parts in each option carefully. No silly mistakes here, please. No scope for any silly mistakes, Jatin. Acidosis. Alright, so I'll tell you the answer is D. High blood sugar, increased glucagon to insulin ratio, and decreased blood pH. Acidosis is what? Acidosis is low pH, isn't it? I think this is where you got confused. Okay, so just look carefully at each and every part. Now, diabetic ketoacidosis is where the blood sugar is very high and the cells are not able to utilize it due to either resistance to insulin or the absence of insulin. So what happens is the cells give a signal that there is a deficiency of glucose. So the body shifts its metabolism towards ketogenesis by rapidly beta oxidizing the fatty acids. At a very high rate, when the fatty acids are oxidized, then what happens is ketone body synthesis starts. Okay, ketogenesis starts. Now, ketogenesis will start, then ketone bodies are what? They are acidic in nature. A high level of blood ketones is going to shift the blood pH towards acidic state, metabolic acidosis. Metabolic acidosis will ensue. Okay, therefore it is due to diabetes, that is either either due to non-secretion of insulin or due to non-action by insulin, that is peripheral resistance to insulin. Okay, mostly it occurs in type 1 diabetes due to almost absence of insulin. Ketoacidosis. Okay, so insulin is not present, therefore glucagon to insulin ratio will be high. High blood sugar, yes, and decreased blood pH. What is the treatment? The treatment is, because of the high blood sugar, there is dehydration. So you give fluid rehydration, IV fluids. Also, you give insulin infusion as the definitive treatment. Okay. Understood? IV insulin infusion as the definitive treatment. You can also infuse potassium to increase the insulin entry into the cells. Understood? Under monitoring. Okay, monitor arterial blood gas through ABG analysis, arterial blood gas analysis. You should monitor every hour or every 2 hours depending upon the severity. Okay. Jatin, the Telegram link is already given here in the description. You can check out. How do we get the insulin, Jatin? We have discussed this. We have discussed how do we get the insulin. The exogenous insulin that we take, how is it produced? B, C, and A. These are the three strands in the endogenous insulin. Now, if you remove the C peptide, you're only left with B and A peptide. So, the insulin that is extracted from the human insulin that is extracted, it is treated so that the C peptide is removed and A and the B peptide are then injected. Earlier, bovine or porcine insulin used to be injected, but that used to cause a lot of immune reactions. Therefore, human insulin has now come up. Understood? Great. Understood this? Telegram link is there available for Unacademy Future Doctors. There you can join Jatin. Okay? The Unacademy Telegram link.